Hi, I'm Dr. Sulata Shenoy, Psychologist and Director, Turning Point, Center for Psychological Assessments, Therapies and Counseling, Jayanagar, Bengaluru. Hair pulling or trichotillomania is one of the disorders which are classified under psychiatric disorders. Now, how it manifests is a person may be increasingly pulling out hair either from the scalp, eyebrows, sometimes even eyelashes. Along with that, plucking of the skin around the fingertips or any other part of the body. So, mainly it refers to hair pulling disorder. Now, you may wonder why one would do that and whether it is indeed a disorder or it's just a habit some of us pick up. It becomes a disorder when it is extreme in form. In fact, I have seen children who have had no eyebrows, no eyelashes, bald patches on the head which keep growing because the networking of hair is lost. So, around the edges of the patch in which the child pulls out becomes increasingly weak. So, these also become, the child starts to develop bald patches and in fact may also end up pulling every hair on his head if intervention is not provided. So, when it is extreme, it is no longer just a habit, it is a disorder, and often it is linked to anxiety, depression, stress in life and any other negative feelings that the person may be having, and this is commonly seen in children as young as 10 years and upwards, and with more females having this disorder more than males. So, as girls and women are known to be highly emotional, probably this is part of the expression of emotionality. And this happens in two ways. One is a focused trichotillomania, that is, a person extremely focuses on it and wants to pull it out, or it is somewhat unfocused or automatic when a person is seeing the TV, maybe preoccupied with something else and then pulling out the eyebrows or the eyelashes, etc. Now, you may wonder, is this not painful? And why would a child or an adult do that? Okay. Now, it has been found that the pain of pulling out the hair is minimal in comparison with the sense of relief or some sensation that the person gets in pulling it out. And that outweighs any kind of pain, and that becomes a pleasure reinforcing cycle where the person wants to do it again and again and more and more. I have seen children who pluck their hair, hide it or throw it behind the toilet and try to or push it under the bed sheet. So, a number of ways in which a child would be trying to hide it. So, when you discover that the child is having this disorder, it is time to consult a psychologist and find out various treatment ways such as therapies such as habit reversal, cognitive behavior therapy, anxiety therapy, relaxation therapy and family counseling.